Hi. So before I sit down, I'm gonna examine your mom and ask her a few questions. All right?
Okay, but I don't think she will say much.
Okay. Hi, my name's Sheila. I'm gonna be your nurse today. What's your name?
I'm Betty.
All right. How are you feeling today?
Oh, my head really hurts.
Yeah. If you had to rate your pain on a scale of 0 to 10, 0 being the worst and 10 being excruciating, would you be able to do that? No? Can you point to where it hurts? Yeah, I can tell it hurts pretty badly. I'm sorry, I know it can be really tough taking care of a family member that's sick and yourself.
Yeah, you're right. It's something like we were not prepared for. And can you tell me what should I expect from her now?
Yeah, you talked to Dr. Donahue, right? And he explained that your mom had a stroke.
Yeah.
So a stroke is where you get lack of blood flow and oxygen to the brain, and it causes cognitive problems. That's kind of why she's not, how she used to be in this situation.
I'm sorry about my tears, but
okay. Here you go.
thank you. But she was so full of her life, and everything happened so quickly.
Yeah, I know it can be really confusing. So there's two types of strokes. Maybe I can help clear it up. One type of stroke is you have a blood clot and it doesn't get blood to your brain, so then you lose oxygen and that causes cognitive problems. And the other kind can be a blood clot that's also in the brain, but it bursts while it's in the brain. So it's kind of like when you get a cut on your arm and then blood comes out, but in the brain there's no place for the blood to go. So the pressure just builds and builds and builds, and you get that's kind of why your mom is the way that she is right now.
Oh, that's so awful. Which one did she have?
She had an MRI, and it showed that she had the one I was talking about, that the blood clot burst inside of her brain. But it showed her on her MRI that she didn't have any more bleeding, so she didn't need surgery.
Oh, how did she have the burst in there? She didn't fall or hit herself or anything.
So sometimes pressure builds up for lots of different reasons. There's high cholesterol, which can cause high blood pressure. High blood pressure can cause just a lot more clots and things like that. It's kind of like how I explained earlier with the cut on your arm. Mm-hmm. The pressure just builds and builds and builds because it's a cut. It's a burst of blood inside your skull. Mm-hmm. So it's a bruise that gets worse and worse, and it causes lack of oxygen in your brain.
I didn't hit her head though.
Yeah, I know. I was just kind of trying to use that example of falling and hitting your head as to explain high blood pressure, and that's kind of what your mom has going on.
I think she did have high cholesterol, and she was taking medicine for that.
Yeah, I know. Often the damage can be just from a blood vessel that's had too much blood pressure, and then it finally just bursts and gives way.
Wow, I thought if you're taking medicine, then you're safe.
You're right. Well, it does help to be on medicine, and that can definitely lower your blood pressure. But sometimes it's just your body can't take it, and things kind of go wrong, and then you get situations like your mom.
Well, I thought I've been very lucky to have a healthy mom, but I'm not ready to lose her yet.
I know. I'm sorry. This can be really difficult, and we're going to get her feeling better and get her on some medicines and so we can monitor her blood pressure and everything else that's going on after her CVA.
Thank you so much for talking to me. I'm glad that she is here now.
You're welcome, and being here I know has been really difficult. We're going to start looking for long-term care facilities for your mom. And things like that. So it's a facility where she can go, and they have special equipment. They can take care of her, monitor her blood pressure, so that she can get out of the hospital, out of here, and recover a little bit better.
Does Medicare pay for that?
Yes, I'm pretty sure it does, but the hospital does not. So we're going to have to get her out of here, the hospital, and into a long-term care facility pretty quickly.
You mean you have to get her out of here?
Yeah, I'm afraid that once she goes to the facility, they're going to take care of her over there, and your insurance will be able to pay for that, and she can recover over there in the long-term care facility.
Can you pause this? Well, it seems a lot quicker to send her home right now. I've heard women are sent home a lot quicker than after having a baby than it used to be.
Yeah, I know you've probably been hearing that on the news. Babies are a little bit different than from having a stroke. Usually we try to get patients out into a long-term care facility place a little bit quicker because because the longer they're in the hospital, the more risk of an infection they have. So we try to get them out to a new care facility for that reason.
Okay. So what do I have to do now, and by when?
So now you'll have to, I'll leave and go talk to the social worker, and the social worker will come talk to you, find out what long-term care facilities are kind of close to your house, what ones work well for you, which ones the Medicare will pay for, and then we'll get your mom discharged, and I'll give you some more patient education about the stroke and what will happen at the long-term care facility, and you guys will be good to go over there.
Thank you so much. I'm a little bit worried about everything, but I think you know what you're supposed to do, and that makes me feel better. Thank you so much.
Yeah.